one of the things I've observed, and we had this conversation earlier, but I'd like to get it on record, is it seems like several different chronic and life-threatening illnesses um, get mentioned together in the same sentence, especially cancer, AIDS, chronic fatigue syndrome, and oftentimes some others. I see this especially in my exploration of alternative treatments, whether it's low-dose naltrexone or high-dose intravenous vitamin C, MAF314. These all seem to get targeted to group, to these what would seem to be disparate, different groups, and yet they're all, what they have in common is that they're chronic and life-threatening illnesses. And I'm wondering if you could share again what you shared with me about what is the link between these conditions, if they benefit from a common treatment in any way.
Well, these conditions, each of these conditions is not a single condition. When you're talking about cancer, you're talking about at least 600 different diseases. And when you're talking about chronic fatigue syndrome, it's a really complex definition, and also the definition is not unanimous as yet. And again, when you're talking about AIDS, you're talking about a syndrome, so it's an array of symptoms, array of conditions. Now you're putting together three things, and each thing in itself, each item in itself is very complex. But you're right. There are some approaches, in particular those that you mentioned could be called nutritional approaches, that appear to provide some benefit in conditions as different as those. Therefore, some approaches must be targeting something that it is in common in these conditions that are definitely very different. Let's keep AIDS aside. Let's talk about cancer. We know of many genetic alterations of different types of cancer, and therefore we know that different types of cancer are different. We know that chronic fatigue syndrome has little or nothing to do with cancer from the genetic point of view. So what do they have in common? In my opinion, and not only in my opinion, I will give you some demonstration about this, all these conditions have in common to be chronic. We are not talking about acute conditions. And when you have a chronic condition, our body responds in a very monotonous way. It is our body responds always with some basic mechanism that are always the same, regardless of the cause of the disease. That's why there used to be, at least in European university, a matter that was called general pathology. That doesn't exist in the Anglo-Saxon educational system because it derives from the German educational system. It was called allgemeine Pathologie, that means general pathology, that was not looking at the single specific causes of each given disease, but was looking at the common mechanism of most diseases. And to answer your question, we think that systemic inflammation is common to all these three conditions that you mentioned, cancer, AIDS, chronic fatigue syndrome. By the way, chronic fatigue syndrome is an old terminology. According to the international consensus criteria, now it is more appropriate to call it myalgic encephalomyelitis. Myelitis stands for inflammation of the brain, encephalomyelitis, because that's the common aspect of the complex picture of chronic fatigue syndrome. The problem is that myalgic encephalomyelitis is very difficult to pronounce, at least for me. So either you call it ME, that nobody knows what does it mean, or CFS still remains the acronym that has caught people's attention. So chronic inflammation accompanies these three conditions. Is chronic inflammation the primary cause of these three conditions? Of course not. But does chronic inflammation contribute to the progression, to the progression toward a worse, to the worsening, the progression toward a worse outcome of these conditions? The answer is definitely yes. This has been known for years. That's why several approaches, like the approaches with nutritional probiotics, for example, with vitamins, for example, that are nutritionally just the same, appear to work. Because chronic inflammation is not the cause of cancer, of course, but it contributes to the worsening of the condition of the individual patient. It contributes to the progression of the disease. Quite recently, I think it was in June or July of this year, so a few weeks ago we could say, we published a paper in the American Journal of Immunology, which was a kind of a challenge for dissidents, as we are labeled to publish in a journal of immunology, but they were open-minded, they accepted our paper. This paper has nothing to do with AIDS, but this paper examines terminally ill cancer patients who are in the last stage of the progression of their disease. And we found very clearly, and we published those results, that there is a correlation between the outcome, the negative outcome of the disease, and the levels of one marker of systemic inflammation, which is called C-reactive protein, or CRP, if you prefer. This CRP is a very unspecific marker of inflammation, and we found that in those cancer patients where the CRP was elevated, the outcome was invariably negative, regardless of the stage of the cancer. Here we were talking about all stage 4 cancer patients with metastasis everywhere, patients who could not undergo any type of therapy because they had already undergone whatever could be done. So people who had been sent home with a prognosis of a few days or a few weeks. Well, if you could provide them appropriate nutrition with all possible tricks, and if they had low C-reactive protein, they could survive years with an acceptable quality of life. But if you were not able to control the systemic inflammation, if you were not able to feed them appropriately, they would die in a matter of days. So there is an index which is called Prognostic Inflammation Nutritional Index, PINI. And this index takes into account a number of hematological parameters. It's a complex algorithm, it's not an easy one, but it is published now for many years. And so this index reflects the nutritional status and the inflammatory status of the patient. In cancer, it is applied. I don't know whether it is applied in AIDS, I don't think so, and I am sure that it is not applied in chronic fatigue syndrome. But this index is very interesting because it does not address the disease in itself. The cancer is not like a tumor marker, like a PSA for prostate cancer or a CEA carcinoembryonic antigen for other types of cancer. So this index has nothing to do with the cancer itself, but it assesses two things: the inflammatory and the nutritional status of the patient. In this case, the oncologist disregards the cancer, mostly because everything has already been done for the cancer, and concentrates on the inflammation, systemic inflammation, and on the nutritional status of the patient, and tries with all means to improve this. If the oncologist succeeds, the patient survives. Otherwise, the patient dies. This tells you that this nutritional and inflammation status is the common denominator of all these chronic diseases. And in the beginning of this year, 2012, that I think it was in March or April, we published a paper in the journal Medical Hypothesis that you may remember because it's the journal where our paper, along with Professor Duisberg's papers, was withdrawn 2 years ago. Well, also in that journal they're open-minded because they accepted another paper of ours, not dealing with HIV. Probably they will never accept paper of ours dealing with HIV or AIDS, but we accept this shortcoming of theirs. But they were open-minded, and we published a paper where we demonstrate that we could measure the brain inflammation in CFS patients. We did not demonstrate that there was brain inflammation in CFS patients, but we demonstrated we could measure it. So it was a kind of a methodological paper where we demonstrated how we could show that the CFS patient has inflammation in her or his brain. And I will show this data the day after tomorrow, because we are convinced that not only chronic fatigue syndrome patients, they have brain inflammation, but all patients with a chronic condition. As you know, people with cancer suffer of chronic fatigue, and this is kind of obvious.
And I think that's true of people with AIDS.
Or HIV infection. Of course, chronic fatigue syndrome, it is called exclusion diagnosis. Because if you have chronic fatigue and you have cancer, nobody cares about the chronic fatigue. Everybody is concentrated in fighting the cancer. If you are fatigued and you have AIDS, nobody cares about you being fatigued. Everybody tries to fight AIDS or the virus or whatever. If you have nothing else, then they say, well, you have chronic fatigue syndrome, let's try to do something. Chronic fatigue accompanies all chronic diseases, and this is kind of obvious. Less obvious is the fact that you might have a chronic inflammation also in your brain, and this is related to your chronic condition, of course, but it might not disappear once, let's say, your cancer has been removed, surgically removed. Just before coming here to Wichita in Kansas, we were at a meeting and we were listening to the latest results on multiple sclerosis. And we learned, we didn't know this, that also in multiple sclerosis, you have accumulation of iron deposits in your brain with consequent inflammation, and this, according to the speaker, the iron storage, the erroneous iron storage in your brain, and the consequent inflammation was responsible for the symptoms of the multiple sclerosis. We also learned something that we didn't know because, of course, we cannot study all different fields of medicine. And multiple sclerosis has many, many symptoms. And this neurologist told us that if you ask a patient who has multiple sclerosis and all kinds of neurological symptoms, cannot walk, cannot feed, cannot do anything, and you ask him, look, what is that disturbs you most? If you could ask to be alleviated of one single symptom, what would you choose? And he said, the fatigue. The fatigue is what disturbs me most. I can accept that I cannot walk, I can accept that I cannot coordinate my movements, but what really hampers all my life is the fatigue. So this light, a bulb light, went on in my head. Said, look, here we're talking about a completely different condition, neurological disease, but the fatigue and the inflammation, which is consequent to the iron deposit in the brain, again, is a common denominator. And then, of course, the idea came, why don't we try to address also these problems in multiple sclerosis with this PINI index, nutrition and inflammation, and try to address these aspects that, again, they are not the cause of the disease, but they might be instrumental in developing the disease, in worsening the disease, in the progression of the disease. I don't know if I've been answering your question.
Yeah, yes, I'm just thinking you're going to have to keep adding to this list. There's lupus and there's all these other conditions that fit in the same category. I just picked three to limit it.